Hello, my name is Dr. James Perkins. I'm a chiropractor and naturopath, and I'm the clinical director of Alternative Health Solutions, LLC in West Bloomfield, Michigan. I'd like you to watch this next episode in a series of videos because it's very important that you watch all the videos. This particular video is going to be titled Nutrition and Metabolic Treatment. And we're going to talk now a little bit about actually the treatment using alternative methods as opposed to the diagnosis and as opposed to ancillary procedures. So the key to this thing is you need to go to a couple of things that have already prefaced this video. So you can do that after we're done here if you'd like. One is my website, my-alternativehealth.com. Please go to that, and under our treatable conditions and our techniques, our approach, etc., just go to the home page and scroll down to Balancing Body Chemistry, also known as Clinical Nutrition. And there's a short article there that would help you to understand kind of the preface of what we're going to be talking about today. Also, you can go to our YouTube channel, Alternative Health Solutions YouTube channel. And there's a bunch of videos on there. One of them, which would preface this video very nicely, would be talking about clinical nutrition, and that video talks about clinical nutrition as opposed to general nutrition. So anyway, what I'd like to talk to you about today is the actual treatment of conditions that respond very well to nutrition and alternative methods of treatment because a lot of the new patients that come into our office, that a lot of them have not utilized alternative care before, but I hate to say it, are kind of at their wits' end. We're kind of their last resort in their minds, so to speak, because they've tried medical answers to the problems that they're having, and they're not really having the great outcomes that they really want to have, and they've been told they are going to have. And so out of frustration, they're going to try something different. And oftentimes these people have been told that, oh yes, you can go to these different doctors, but really the treatment that they use is not going to be beneficial to you because it's not powerful enough. It's not like drugs. This is what I'm trying to get through in this video today, is that to discuss a little bit about treatment to these conditions. I think that's a great understanding that you could have, because these conditions are treatable. And to say they're not, well, I've been treating conditions for 33 years. I've got great success, and millions of other alternative practitioners have been successfully curing things that have been either misdiagnosed through other traditional doctors, or the methods that they're used to treating the condition are not getting the outcomes that they wish they could get. So we want to talk a little bit about how this treatment occurs. Once diagnosis is made, and the key to diagnosis is finding out the actual cause of what your condition is. This has been a wonderful thing in our office, and we see this with alternative practitioners. For some reason, alternative practitioners of all kinds of different kinds of techniques, their main goal is to find the actual cause of why you're having the problem that you're having. And oftentimes that's far distant from where the pain is, or from where what seems to be that failure of the body to do what you want it to do or to heal up. And so you have to look elsewhere, and I think that we kind of look outside the box a little bit more. And I think that's why we get such good results in what we're doing, because we're not just masking symptoms. We're actually getting to the reason why you're seeking doctors or practitioners to try to be a team player with you in your health care and try to get you better. So the idea here is firstly diagnose and get to the cause of the problem. And believe me, these doctors out here are good. They can do it. You want to know the cause, because with treating the symptoms, you're not treating the cause. You're treating something that's come down the line over the years, and now it's making you feel better a little bit, but it isn't going to cure the problem. So now we're going to talk about what happens when we find the cause of the problem through physical measures, physical examination, energetic examination, and the different things that we use to get through it, including patient case history and other things that other doctors have used, such as pictures or scopes or things like that, that really, including blood work, which oftentimes becomes, those things are oftentimes not as useful as some of the other energetic tests that we use. So now we've diagnosed, and now we want to try to figure out what we can do to help the patient. So the idea is to match up the curing natural products, so to speak, to the condition that you have. And that treatment will be successful if that match is correct. So the idea is to take the condition that we have and find out what we can do, what we can use of nature to heal you. And a lot of these clinical products are not like general nutrition, they are clinical nutrition. And we talked about that in the website, and we also talked about that in the YouTube videos, so please look at those, it's important. So finding the correct product, and there are thousands of things we can use. A very good example of this is viruses. And viruses are not difficult to take care of. In fact, viruses are, for the most part, pretty wimpy. We can take care of those. I've got at least 20 products right off the top of my head that I can use to knock out just about any virus you have. So we're not going to worry too much about viruses. We don't in here. This idea that, well, if you got a virus, there's not much that can be done. Well, you hear that on TV and you hear that on radio ads and TV ads, but the truth of the matter is, it's not that difficult. So we want to talk about things of nature that can treat just about any condition that comes into the office, especially those things that are on our treatable conditions list, and that also is on the website. And click on the tab Treatable Conditions and you can read about those too. So what I'd like to do is talk about some of the things that we have in here and some of the things we've taken from other experiences of other people. And I'm going to give you a quick example of this because I think it's important. A lot of people right now are concerned about bone loss, and particularly with females, and the reason for that is that there is a hormonal component to bone loss. It's not talked about a lot. We talk about it in here every single day. And DEXA scans is the name of the scan they like to use to indicate that there is bone loss. I don't know how effective this scan is, but I know one thing. When we treat bone loss, we get results on DEXA scans. We've had DEXA scan operators that tell our patients, this is amazing. We've never seen results. We've never seen anybody get better by treating bones with nutritional substances. Well, it's interesting that there is a product that was developed by a medical doctor. His name is Dr. Russell Marker. Russell E. Marker developed progesterone cream back in 1938. This is nothing new. But progesterone is the female hormone that builds bones. So when women come in here, and that's one of the complaints they have, or we find that they have bone weakness on our testing, and that needs to be addressed, we often go right to the hormonal system and look to see, and invariably they have a significant deficiency in progesterone. Whether it shows up on blood or not, it's not important to us. If we find that they have a deficient in progesterone, which we have ways of testing, we use Dr. Russell Marker's program from 1938, which works wonderfully, and that's a transdermally accepted cream. Rub it on. The reason for that? Progesterone is not absorbed by the gut very well. So using other products, medical products that you get by prescription, and of course there's estrogen and there's progesterone. Progesterone is the antidote to estrogen. A lot of women just can't manufacture enough of it. After they become older, they're in years of non-childbearing, and progesterone gets its name because it promotes gestation of the child. But it does one other really cool thing. It produces and helps to tell the body to produce osteoblasts that help rebuild bone. Estrogen tells the body to produce osteoclastic activity, which actually tears down bone. So if you have too much estrogen, you're going to tear down your bone. If you replace that with progesterone and you balance it out, now you're building bone again with progesterone, and it's easy to do with transdermally accepted progesterone. And so that's one of the things we want to look at. And it just goes together with building blocks of bone. a lot of people are not getting enough minerals, and I'm not talking about calcium. I want you to understand something. It's very important to understand this. There has never been a study done that has proven that by taking calcium, you're going to build your bones. If that were true, all the DEXA scans would be getting better and better and better, and everybody would have nice, healthy bones. So calcium is the most abundant mineral on the planet Earth. It's in everything you eat. Now, the milk manufacturing, the people who manufacture milk will tell you that without drinking milk, you will not get calcium. It's not true. Most people are not calcium deficient. If you take too much calcium, you end up with kidney stones. So it's very important that you understand that by taking calcium, you are not going to build your bones. It's impossible. And that's because it's only one mineral that you're trying to use in the bone. The bone matrix of the bone, the actual cortical bone, has a lot of minerals in it that need to build that bone. So nutritional products that contain those minerals are wonderful for building blocks, and you add the progesterone to that, and we get wonderful results on DEXA scans. So it's important that you come to us to be tested correctly and to be used. If your doctor's telling you to go and get Oscal to build your bone, it's not going to work. Trust me, it will not happen. And your DEXA scans will stay the same, and you will know that. And that's why you need to be here. You have to be tested correctly. And the products need to be tested correctly. So this would be a product. It's a tub of progesterone. And we have a little chart on how you take it. It's easy to use. And within 3 months, we see improvement on DEXA scan when it's combined with a product like this. People talk about calcium building bones, which does not work. Strontium has been used in Europe to build bones for at least 30 years. They've been using this product, and it builds bones. So we always add a little bit of strontium to the bone builder mix, which is boron and silica and magnesium and manganese and all of the different things that the bones need to be strong, not just calcium. This is where we kind of go wrong. Everything seems to have to be simplified. Well, it's not always that simple. But you combine these two together and you increase bone density, even at the cortical level. Unlike some of the drugs you take, which only build periosteum, which is the outside of the bone. And that's where it's a false DEXA scan. People say, oh, your DEXA scan is coming up by 0.5 point, or it's coming up by a whole point in 5 years. Well, it's a false, because they're only looking at periosteum. It's important to build cortical bone, the inside of the bone. And you can build that matrix, that bone matrix up with a combination like this. So again, this is an example. It goes on and on. But conditions are treatable. The practitioner only has to know what the true diagnosis is, the cause of the problem. From there, it's quite simple. You custom design a nutritional program that rehabilitates, revitalizes, reorganizes, rehabilitates the body's system. Drugs cannot do this. They can only put you into neutral or even shift you into reverse. They can't really shift you into first gear. So we want to get this thing moving down the road here. And you can rehab metabolically, you can rehab organs in the body. We do it all day long, we do it every day, and get great results. So again, treatment then is based on finding the cause of the problem, matching up the correct nutritional concepts or therapy concepts, whatever they may be, chiropractic care, acupuncture, hypnotherapy, fascial release, massage therapy, whatever it is, those things are also added to it. It really helps. And so the third thing then, of course, would be how long the treatment is and what dosage you would use now and for long-term support. And so those are the components that we look at. We treat along this way because the person, I call it the cake. And everybody has a different cake. You can go to the vitamin shop and you can go to GNC, and that's General Nutrition, and you can put all the icing on the cake you want, and it looks beautiful, but it really may not work unless you know how to improve the actual cake itself. And so everybody has a cake. If it's bones and you have weak bones and you have a weak hormonal system, you need to know that. You need to find that out. If it's your heart and your cardiovascular system, you got a tired heart, you need to know how to revitalize the heart. The heart's the easiest organ in the body to revitalize. The results with a tired heart are miraculous. Within days, people feel better. Within weeks, the heart feels better. Within months, it's revitalized. So we have organ systems in the body that need that long-term care and support. Now we get you on some kind of a maintenance care because that's going to be your cake. If it's respiratory system or digestion, if it's hormonal system, like I said, if it's even post-concussive syndrome, brain injury and traumatic brain injury and PTSD, anything like that. If you have trouble with vitamins and you can't absorb your vitamins, now you're getting into autoimmune disorders along with inflammatory disease. So if you have inflammatory problems through your body and you have autoimmune responses, we can fix the immunity due to improving the gut linings, creating a correction for leaky gut syndrome, and then we can give you maintenance care to keep this thing happy through the rest of your life. You don't have these problems come back. They won't come back. But we find this scenario where everything has to be pigeonholed by the traditional medical people. In other words, what I'm trying to get at here is you got a whole series of pigeonholes. You have fibromyalgia, and you've got fibromatosis, and you've got everything along that line, and then you've got all kinds of things like Crohn's disease and irritable bowel and all kinds of gut lining issues like paralytic ileus or whatever everything's pigeonholed, and then you get the drug that goes with that pigeonhole. People aren't like that. You're not like that. People aren't like that. And doctors of alternative medicine and practitioners of alternative medicine do not pigeonhole people. We take you in and we look at you as a whole unit. We try to find out the cause of the body by saying, well, Sally, you have all of the symptoms of a tired thyroid. But yet, really, when we take a look at everything, it looks more like you're having trouble with your sugar handling problems. Oh yes, there has been a lot of diabetes in my family and things like that, because those symptoms of thyroid often mimic the same things as sugar handling. So you kind of know where we're going with this, and then you can guide the patient down this road a little bit and try to look for a correction. So again, I always tell doctors of chiropractic and doctors of naturopathy when I talk with them, don't pigeonhole the patient. It's easy to look at symptoms and say that's the problem. Oh, that's your problem. A good example might be a person lies down on their left side and they get dizzy, or something to that effect. Well, everybody who lies on their side and gets dizzy on their left side, they must have either a gallbladder problem or maybe even an aortic aneurysm. That doesn't happen with everybody, and everybody who throws up doesn't have spinal meningitis, but that often comes up too. So again, here we are trying to use symptoms, and oftentimes it leads to some horrendous diagnosis that really isn't true. It's often a much more. It should be a slow crawl, walk, run test for those types of conditions, and to go right out and say, oh yes, you're having a little bit of visual problem on your left side. That's a brain tumor. I mean, come on, we got to back off on this and try to start out slower than that and say, oh, well, here, you hit your head 3 times and you've had 3 concussions and maybe you have a little brain injury. And so try to look at it more logically, and especially with this patient case history. I've always said, if you just listen to a patient, they'll diagnose themselves most of the time, because they will. People come in here and they know what's wrong with them. They know what they've got. They've figured it out. And I just sit and listen and, yeah, I think you're right. Let's start looking at that as maybe the cause of the problem, because nobody else has looked at it. Nobody listens to the patient. So again, we look at case history and then we diagnose. We find the correct designer of nutrition. We use that for the correct amount of time. We get the results we want, and then we program a custom designed maintenance program for the patient, and good to go. And that's it. I hope that you can understand that the condition you have is treatable. You need to see me. Please call me at 248-855-8707. Go on the website, which is my-alternativehealth.com. Scroll through some of these things. Take a look at this. You look at some of the YouTube channels, our YouTube channel for these videos, and we'll continue to do some more episodes in this challenge to try to get your health and wellness up to where you want it to be. And we can help you do that. Thank you.